If pregnancy is normal, then why are so many moms exhausted, anxious, inflamed, and ignored? If babies are fine, then why are we seeing more colic, reflux, tongue ties, sensory overload, sleep issues, and developmental struggles than ever before? Here's the part no one wants to say out loud. We're medicalizing pregnancy and childhood while completely ignoring the nervous system, the very system that controls birth, bonding, digestion, sleep, immune functions, and brain development. And instead of asking why, we're handed labels, timelines, prescription. Just like that's the norm, that's the protocol.
Welcome to Root Cause Holistic Health. I'm Dr. Jon Harmon, physician, brain health expert, and your host on this no-fluff journey into whole body healing.
And I'm Tracey Green, wellness coach, mom, and co-host in this space where we get real about what actually heals, not just what's trending.
We're here to help you uncover what's really going on and empower you to take the next step in your healing journey.
Today's conversation is for the mothers who felt something was off during pregnancy and were told to relax. For the parents who knew their baby wasn't just fussy. For the families who are done watching their intuition get dismissed in favor of checklists and fear-based care. We're talking about prenatal care that actually supports the mother's nervous system, not just monitors her. We're talking about care for babies that doesn't wait for something to break before it intervenes. And why, what happens in the womb and those first moments of life and months of life can shape health for decades. This episode is about prevention over intervention, regulation over suppression, and why supporting the nervous system early changes everything. Because a dysregulated pregnancy doesn't magically produce a regulated baby, and a stressed nervous system is not a character flaw. It's a clinical reality we've ignored for far too long. This conversation is not comfortable, but neither is watching families struggle from being told it's normal. And with that, I'm going to pass it over to Dr. Harmon, who's bringing on a doctor that actually works with the nervous system instead of fighting it.
Thank you very much, Tracey. That was a very good assessment of the current state of affairs. Unfortunately, in the medical community, this is a subject that I'm extremely passionate about. I've been adjusted since I was 2 years old. And my mom took me to a bunch of different doctors. And finally, the neighbor said, well, why don't you just take him to my chiropractor? And then I was good. And that we grew up being adjusted, not going to medical doctors. So I'm very passionate about this. We're really glad to welcome Dr. Christian Price. Let me just give you a little bit of background about Dr. Price. Christian is the owner and lead chiropractor at Summit Life Chiropractic, a neurologically focused pediatric and family chiropractic office dedicated to helping children and families thrive through nervous system-centered care. He's a graduate of Utah State University, where he earned his bachelor's degree in exercise science, and a graduate of Palmer College of Chiropractic with over 13 years in practice. Christian has built a reputation for working with some of the most complex and challenging cases. This is one of the things that caught my attention. Mm-hmm. His clinical focus is supporting the neurodivergent community, including individuals with ADD, ADHD, sensory processing challenges, autism spectrum disorders, dystonia, and seizure disorders. That's a mouthful. Rather than avoiding difficult cases, Christian is known for leaning into them, helping families who have often been told there are no more options. Through precise, neurologically focused chiropractic care, Christian's work centers on improving nervous system function and unlocking healing and regulation in the body. He regularly witnesses profound transformations in his practice and remains deeply committed to serving families with hope, clarity, and purpose. Man,
Love that.
that neurodivergent part, we had never heard of that when I was in chiropractic
Mhm.
college or in practice, barely a little bit towards the end of my
Yeah.
chiropractic days. Dr. Price, welcome to the show.
Well, thank you. Thank
You're
you.
welcome. I'm just so impressed with the work that you do and that there's somebody out there that parents can turn to. You've helped a lot of people, a lot of infants. I can tell you some of the most, I call them spiritual experiences, where with these little newborns to see the absolute miracles that happen when the parents have lost hope. And we would like you to kind of think of some of those that you can share with everybody. But tell us where you got your passion to do this work, Christian.
Well, it all comes back to actually why I'm a chiropractor. I was raised in a family of five boys. My oldest brother was born with severe disabilities. And a lot of even understanding the disabilities and struggles he had, even come back to where my practice centers today, where there was significant birth trauma. He ended up developing cerebral palsy. He was deafblind. I mean, we could spend just a half hour talking about the challenges my brother had.
Wow.
And growing up, that was a lot of our focus, helping him adapt and watching him, because he's the most amazing person I've ever known in my entire life. And he was constantly told what he couldn't do, what he wouldn't do, and he proved everything wrong, from even learning and teaching himself to walk, because his ankles were completely fused. So he had no ankles at all. They were just fused solid, and he was never supposed to walk, but he figured it out on his own and was stubborn, and that was his personality. But I remember specifically growing up, there was a time where he would get migraine headaches, and his headaches, when he would get them, he would literally start putting his head through the wall. And so we were patching holes in the wall. I remember all the different things we were trying. I mean, he was the extreme example of everything that would have an extreme reaction to medical interventions. He never reacted well. Many examples there. But my mom decided to take him and try chiropractic care with him. And I watched it dramatically support and help him. And watching the support and change really planted the seed for me to become a chiropractor.
I'll bet.
And through years of practice, it's amazing how it's all come full circle to where my practice is really centered around the elements that my brother struggled with, but also getting into it early on with some of these infants and some of the mothers as they're pregnant, and really educating and helping them hopefully avoid some of the struggles, but also create healing that if we start early enough, it's amazing how much the nervous system can heal and how many miracles actually happen.
And you see them every day, I would imagine,
Yeah.
in your practice. And how rewarding is that to be able, and people who have gone through struggles like that, we get this deep desire. I don't want other people to struggle with that. I want to help them with that. And it looks like that's what you've done as well. What do you do as an assessment? And then take us through the steps when someone comes in. How do you determine where to start?
A lot of it really begins with, I think, the biggest forgotten talent and need that families need is someone that listens. I can't
Agreed.
tell you how many times I'll sit and just knee to knee talking with mom and going over things, and they start crying because you're actually listening to them
Yeah.
and hearing what's happened. I mean, the stories that some of these families have gone through birth and different things, it's hard to relive. But actually listening, understanding what happened, and understanding, hey, that process that sometimes had to take place. Because that's the other thing that I think too often people demonize. Hey, this happened, this happened. I mean, my mom relates the story of my brother's birth when they used the forceps to where they don't think he was going to make it. And so they had to use the forceps to help with the birth. And this is what caused the injury that developed the cerebral palsy. But I mean, what would have happened if you didn't have those interventions to help? So there's both sides to it, but reliving it and going through it, it's a process. And listening to the mom, understanding actually how those pieces come into play, And then relating that just to the structure of an infant spine, what areas are traumatized, and then doing a detailed process of actually examining that. So one of the biggest elements I utilize is insight scanning technology, where we're able to actually test the nervous system, see where it's struggling, and focus there, not just sit here and guess and try and help it, but you're actually focusing where that nervous system's struggling so you can bring about healing. And it's amazing when you're consistent and focused on that, what can happen.
Think moms don't have any idea because we're up here. We're, when we're delivering a baby, you really don't know what's going on down there, right? I mean, there's so much that we're dealing with. Dr. Harmon and I talk about chiropractic care in infants all the time. It's a traumatic experience for that baby to see cesarean section or vaginally. So, can you talk about? My daughter was 4 days old when I took her into the chiropractor, and I know that Dr. Harmon has seen babies in the hospital. Can you talk about a little, about when should you get your baby into the chiropractor?
As soon as you are comfortable to do it.
I love
So
that.
I have a regular practice in my office. I have moms, I'll go out and do home visits. So that day I've gone up to several families that day they're delivered and show up as soon as possible. But it's ultimately, I leave it to the mom when she's comfortable, and also making that easy because obviously mom doesn't feel like going out and doing anything. So being able to get to the end of the home, helping that first adjustment happen to make sure we're helping get them set off on the right foot, essentially.
Yeah, and the right foot sometimes is you have such a you have varying degrees of severity from that to probably some partial paralysis to this baby's pretty good, just do a few checks and gentle little movements here and get this muscle activated, and that one's good. What are some of the worst that you've seen, Dr. Price?
Well, we have a little boy that we're seeing in practice actually right now with an emergency C-section, and everything is the most traumatic I've ever even heard of, in that he was stuck in the womb, stuck, of course, and she wasn't able to progress. Her husband described it because she was standing next to the anesthesiologist, and the anesthesiologist said he'd never seen anything like it because the nurse and the doctor were literally climbing on the table, pulling on the baby, trying to get it out.
Oh my gosh.
So yeah, both of them just yanking to get this baby out. So extremely traumatic birth.
And a lot of mothers don't realize, people in general, they talk about so casually a C-section. C-sections are extremely traumatic, much worse than vaginal birth. The pulling and that uterus is clamped down, the big old muscle, and you gotta tug and pull to get that out. So moms aren't usually aware of that. Have you found that as well?
Yes, they are getting better. I have several moms who have that scheduled C-section. Some of the hospitals have gone to where they consider it a gentle C-section, where they really, I think the nice thing is the medical they're starting to see, hey, this is a problem. We can't just grab and yank them out. And so there is actually, I have several moms, because of conditions and different issues, they have to have a C-section. And in that case, they've gotten where they're better at slowly creating this process and not having to yank as much. But no, it's never optimal. It's always traumatic as you force birth to happen completely different the way it's meant to.
In chiropractic college, I was at it used to be called LACC. In our obstetrics class, we had a split screen video of two births. One on the left, I remember it so vividly because this doc was really gentle, using lubrication, helping the baby get out, and the other one must have had a golf game to go to because he's pull, get that one shoulder out, then pull it the other way, pull, out comes the other shoulder. And I thought, wow, it's not just about a birth; it's how you do it. And are you a catcher or are you a grappler, doctor?
Well, one of the biggest questions I always like to ask is literally, hey, was the OB who delivered or is it a midwife?
Oh,
Because
yeah.
then you look into literally the training, the OBs, just like you said, our medical system has gotten to where they're pushed to be in so many places, they don't have time
Yes.
to be patient.
No.
And they're trained to get hands on, rotate and twist and pull the shoulder, just like you talked about, where the midwife's actually in a position where they can be patient and literally just be catcher. And so that's one of those things that I'm like, hey, who did the delivery? Because it already lets you know some of the factors that were in play because they automatically rotate and free that shoulder. And that's how they're trained to do it as an OB.
So, what a great segue. I saw on your website that you do prenatal care. So, I love this. I love how how different that conversation must be with a pregnant mom coming in talking to you and having prenatal care versus going into a regular OB. I say OB, regular OB, right? Because your OB is talking about DTaP. They're talking about all these different things that you need to have during pregnancy and scaring the living daylights out of mom, like making sure you're on the vaccine schedule and all of that. So let's talk a minute about the difference between your prenatal care versus the norm mainstream.
So, one of the biggest factors that I think should be the number one thing you monitor with prenatal care is the mother's heart rate, or not heart rate, her heart rate variability specifically. So, you want their nervous system, of course, in this amazing state, relaxed, because that's what's training the baby's nervous system.
Mm-hmm.
And so, that is one of the key elements is, hey, let's make sure we're getting you in this rest, relaxed state where your parasympathetic nervous system, that rest, healing, digestion is the dominant part of your nervous system. And the medical does not even look at it. And there's so much amazing literature of, hey, how this correlates to everything, even the phases of pregnancy, where that heart rate variability is going to come down and come up and how it's going to naturally be shifting through that. So that's one of the key elements is, hey, make sure we're having you actually in your nervous system going through this pregnancy healthy. And then, of course, there's so many things to pay attention to with, hey, ligament tension, all these things to make sure you're ready to have the best delivery possible.
I love that. And then I'm sure you have a cord clamping discussion, stem cell discussion.
Yes.
I'm sure that's all wrapped up. See, none of that is usually talked about. They want you, like you said, in and out. They don't want to wait for the placenta to completely finish doing what it's doing after the baby is born. What a blessing it is to have you in the Treasure Valley to be able to offer prenatal care to those moms that are pregnant.
And Doc, as your kids get a little bit older, do you delve into the realm of watching their primitive reflexes? Are they going away at the right time and all of those types of things?
The nice thing, if you're watching their nervous system track, those primitive reflexes, those get delayed when the nervous system's stuck in fight or flight.
Yeah.
So you have that startle reflex that oftentimes doesn't go away. Well, why? Because the nervous system's stuck in fight or flight. It's not letting go of those primitive reflexes. So if you're balancing and tracking that, the amazing thing is typically they just naturally go away on their own. And I've had several patients where they're coming in, they're doing brain-based therapies, all these things, and those primitive reflexes are not going away. And mom is really frustrated. And then we actually get the nervous system to relax and balance that. And it's naturally going to usually clear on its own as the nervous system relaxes.
And that makes a lot of sense. It's not like, we say that they go away. I've said that same thing, but what happens is the higher brain starts to take over and dominate because I know how to latch on now and I know how to grab things and the rest of them. So, and that's interesting.
Even looking, one of the things I think that needs to be just simply taught is how the brain develops is it's developing based on the information it's getting. So if the nervous system is sending this chaotic, confusing message because maybe birth trauma, who knows what else, that comes up through the brainstem, and your cerebellum is this organizing area. So it's like air traffic control for all the messages coming in. Mm-hmm. If that is confusing and noisy, the automatic trigger is going to be send that to the amygdala, which is fight or flight center. We got to figure this out. Until that's cleared up, the other areas of the brain you just talked, they're not getting stimulated. So the brain is just trying to figure out how to deal with the world instead of actually moving on to the prefrontal cortex and all those other things because it's just stuck in this fight or flight.
And then the baby doesn't digest well and spitting up and on and on.
Mm-hmm. And then they're often told, hey, they'll grow out of it. but all it does is go deeper into more problems to where then they're older, they can't pay attention. Then we want to medicate them. And then, I mean, you just move down the list from everything.
So, Doc, when you say neurologic-based chiropractic, explain that to the listeners so that they can understand how important that is, and
Yeah.
and that needs to be looked at.
So chiropractic care, the nice thing is we're helping your nervous system in any way. But if you're not actually addressing the area you need to focus on and focusing specifically just on that area, most of us as human beings, we want, like you have an infant come in or anyone, you're like, hey, I want to do everything I can possible. So you want to find everything you can adjust. So this is a human tendency, wanted to do everything we can to help someone. If you're not literally looking at the nervous system where it's struggling, you're going to then overwhelm the nervous system and just make it more stressed. So a neurologic focus is, hey, how do we identify where there's confusion, where there's exhaustion in the nervous system, and then hone in on that. And as that gets better, move on to where it's and progress through things. So that's where the focus is actually focused on the exhaustion, the confusion in the nervous system, not just, hey, trying to identify, hey, this is tight, this is stiff, whereas everyone, hey, this hurts, more of the adults coming in,
Right.
but actually finding where that's happening.
Yeah, and in that respect, less is more because
Exactly.
you're not overwhelming it by a bunch of other information that you're sending into the system. That makes sense. And Tracey, as a mom, why don't you ask Dr. Price what questions you as a mom would want to know about the birth? I know we've had lots of conversations about that, and that moms get in there and it's so rushed and she's up here and everything's down there and they're doing all kinds of things she can't even see. So this conversation between a doc and a mom, I think, would be very helpful on what moms should be aware of, and things that they could even control at all.
Well, exactly. And not only that, so the birth and then right after those first few days, what advice would you have for moms right there at the end? You're getting ready to give birth and then those first few days.
To answer, Tracey, your question, as the mom is really getting ready for that delivery, it's really helping her be aware on the things she should focus on as the baby comes, because we want to prepare her and make sure everything's ready. She's got her birth plan figured out. But then the number one thing is just reinforce the importance of, hey, breastfeeding and helping make sure they really, because especially the first time mom, it can be so difficult. I have several moms right now, they're just struggling through it and tongue ties, different things going on. I'm like, keep fighting that battle, keep working through it. But then also helping them make aware of, like you said, some of the different issues that come into having a medical birth and them wanting to rush right away and give them a Hep B vaccine for something that's completely pointless. There's so many different layers to that discussion,
Yes,
but it's
there
at
are.
least helping them know, hey, you don't have hepatitis B. You don't have an STD, so why are you worried about this? Don't give more trauma to the baby than is necessary. Just make it that simple. And just kind of giving those basic guidance and let them know that I'm there for them. It's like I said, I go do that home visit and everything right after the delivery as well.
I love that. I love that you brought up breastfeeding. I nursed my daughter till she was 3. So I'm, chiropractic care, nursing, that's, exactly what I did. And I
What? One of the
wouldn't do
most
different.
fascinating, I don't know how new of a discovery it is, but the differences in mom's milk between a female baby and a male baby. The mom's milk has a higher protein and fat concentration in a boy's milk than it does in a girl's milk. And if the baby's sick, it sends signals through the mom. The mom's body responds to send down the right things for protection from whatever's bothering. It's so intelligent, and it gets so mixed up with all of the vitamin K shot and all of these the toxins that go in there, and the babies. No wonder your practice is so full with you know, spectrum and autism and ADHD and ADD. It's so needed right now. Do you also help the moms if their kids did get some of those vaccines, help them detox all of that stuff out of them?
So often I'll help with and work with, excuse me, often what I'll do is work with different functional doctors and help make sure that, hey, those things are happening. Because the biggest thing I don't want to be is the jack of all trades, meaning I'm going to guesswork at how to help with that process.
Mm-hmm.
So there's different things I'll recommend, but I'm like, hey, we need to get through a functional, we need to work through that process if it's needed. And then we can actually work together and make sure they're healing the best way possible. So if there's detoxing or things that are needed, that's how I like to handle it.
I love that. And I see a lot more of that nowadays where, you can't be everything to everybody. And if you try to do that, you're not very good at some of those things.
Yeah.
I want to go back to what you said, Dr. Harmon. A mom's body is amazing, so it knows there's something going on if you have a sick baby. So like you said, that milk is going to adjust.
Mm-hmm.
So I think, Dr. Price, what I'd like to hear is your opinion on, fevers and infants and, when is it an emergency?
Well, I just had this discussion today with a patient. She was like, what do I need to do? Because they're had a fever of 103. She was all freaked out. I'm like, no, it's fine. And the number one thing, I'm like, hey, watch the fever. If it is getting where it's staying high and it's not varying and changing, that's when you got to be concerned. It's not being high that's the concern. Your nervous system's amazing, and it always is adapting and flowing, meaning your fever will go up and spike, come down and spike and come down. So that's how you want to watch, is make sure it's adapting and changing. If it's doing that, it's the healthiest thing in the world. That's actually allowing them to fight the illness. When you, of course, this is one of the things educating. Hey, when you give the Tylenol, you're going to be 6, 7 to 10 days longer. Do you want that? I mean, the research is very clear showing that beyond what Tylenol is actually doing. And like some of my patients, I strongly believe, hey, you're free to choose what you want to choose. So I'll have the discussion on vaccines, for example. Mm-hmm. And there's some of my patients, they still want to do it. Hey, this is their choice, and I support them in having their freedom of choice. But then I also educate them, don't do Tylenol. Don't take something that stops your body ability from detoxing and actually helping to manage what you're putting them through. And so it's helping educate all those different realms and accepting everybody has their own choice of where they want to move along, as long as they get all the information.
Which is a good place to be, because you're not coming from a place of judgment. And then, moms who've been really indoctrinated in that side of medicine, a lot of them tend to just follow along with that. And if you disrupt those deeply held beliefs, they're gone. They go somewhere else.
Mm-hmm.
I'm in a lot of mom groups, and these babies or toddlers get fevers, and they're going to the ER. And I'm thinking, why are you exposing your infant to an emergency room? And so I always comment, find a good chiropractor. Find a chiropractor that specializes in infants and toddlers. Can you explain why an ear infection or a sick baby, a sick toddler is okay to bring to the chiropractor, and why that would be beneficial than run into the ER?
Oh. So ear infections is an easy way to start the discussion. And I mean, so many families go into the whole treadmill that starts there when literally they're just, think of it as they're poor plumbers. So I was just explaining it very basic, simple terminology is, hey, there's junk that's supposed to drain. And we need to help that process move along. And actually how your cervical spine is moving and how those muscles are coordinated, everything actually is what's creating the drainage so they can get rid of these fluids. And if they get stuck up there, the ear infection is the natural result. The fevers come up. So it's explaining, hey, why is this happening? What's going on? How can we actually correct the underlying issue and not have this snowballing effect where, hey, we had ear infections again, we did antibiotics, and then you start going down the road of, hey, that's how it's disrupted. And I mean, just patients, I have a patient we started this week, was gone through, and mom didn't realize till we started talking about it, she did 6 rounds of antibiotics for ear infections and tubes. And she's like, the tubes work great. I'm like, no, this is why she's having all kinds of other issues now, because Drainage, sure, you're helping get the drainage from the ears now by putting the tubes, but you still have all this gunk that's not flowing out or moving out as the way it should, and constantly inflaming her lymph nodes to where her tonsils are swollen all the time. And so then you just see how this snowballs down the road, I guess.
It seems like a pattern. They're getting ear infections, and then they're getting tubes, then all of a sudden they're tonsils, so they're getting their tonsils removed. I don't know about you guys, but I want to keep I want to keep my tonsils, I want to keep, keep my organs intact. And I don't want my kids going in for surgery. That doesn't seem right. When there's other options like chiropractic care rather than, antibiotics that destroy your gut. And I think a lot of moms are finally waking up. I think the last 5 years have really given us time to pause and understand that we don't need a pill for everything, because then that pill, you need 3 other pills because of the side effects. And I think moms are finally understanding that. So hopefully gut health, gut brain health, hopefully that is people are more aware of that these days.
The nice thing is, like you said, the last few years and all the craziness we went through has woke up a lot of people in that they're looking at it from a different viewpoint, and they're able to actually see, hey, that's not that great of a process. And they start seeing the treadmill they're literally getting stuck on, perpetually looking for the next medication instead of actually resolving and finding the root cause of the problem.
Mm-hmm.
I like how you said the name of our podcast in that last sentence.
He's got it on his website too.
Well done.
We've got him programmed already.
Yeah.
Wow, this is such great information. And, being a chiropractor, I figured that you were, doing all this good work, and you've actually expanded that out than most, or further out than I think most chiropractors, where you're focused on prenatal, and you're focused on kids and difficult cases with those spectrum and those sensory processing problems. I think it's such a needed thing today. And moms, I think this is really going to resonate with them. And I hope that this message saves children from the inevitable problems as adults by getting things taken care of early.
Yes.
So
even the big thing is, even if you don't start early enough, it's amazing how much the nervous system can heal. I have a 26-year-old, very severely autistic male who's coming in, and the most rewarding conversation we had a few weeks ago with mom is that she was crying and telling me she gets to sit and have conversations with her son now that she's never had.
Wow.
And he's 26 years old. This is not supposed to be possible for him.
I love that.
So,
Yeah, I love that. Not supposed to be possible. Really?
mm-hmm.
I mean, in your world where you do all those things, it's not possible. But when you change it and actually help with the resolution of the problem, that's different.
Yes.
Do you have any other, I love stories like that. Do you have any other stories that really stand out over the last few years of your career that you can think of?
So, yeah, a story that's always stuck with me is this little girl came in, and she had severe autoimmune issues that were triggered. She'd been doing functional medicine. She'd been doing everything you can imagine. It gotten to the point where her knees were so swollen, went from a very active, healthy little girl to where she was literally in a wheelchair the first time she came in. And mom and dad didn't know what was going on, what to do. And it's so much fun now because literally every time we see her, she's doing new things she hasn't never done. She's in gymnastics, all these things, and no limits at all. In the autoimmune, they can't find anything in anymore. And all we did was literally, for me, was helping find where her nervous system was struggling. Then when we got her out of this sympathetic fight or flight storm she was in, we sent her back to her functional doc. Then she was able to actually take over and get over all those autoimmune issues. And she's literally gone from a wheelchair to this just running, happy, crazy kid. And it's so much fun watching that. So, I mean, just varying stories from that to there's another little autistic boy that has been coming in, and his mom, her big win after 2 weeks of care is she was excited to start wearing short sleeve shirts again because her son would bite her so much. She had bruises all up and down her arm.
Oh my.
And
Oh.
so she was excited, literally, she could wear a short sleeve shirt. I mean, it's just little things we never think of that have such a dramatic impact on people's lives. And now this little guy is communicating, talking. We're having, I mean, his visits are so much fun. And he's a completely different boy from the aggressive, struggling boy who was just stuck in fight or flight, trying to figure out how to move past that.
Their whole family, their whole life has changed. Imagine being afraid you're going to be bitten.
If you're stuck, I mean, just the poor little guy stuck in fight or flight, doesn't know what to do. And then he gets where he's frustrated, hits his head. And what's mom going to do? She's going to try and restrain him so he's not hitting his head. And then, of course, your natural thing, if he's stuck in fight or flight, he's trying to get out of that. And so that's where, of course, the biting, just this natural thing, not necessarily natural. I don't think that's a good way to put it, but you start seeing how that happens.
It's a natural response.
Aggression. Yeah, a natural response.
Yeah. Wow, you're doing great work, Doc.
Thank you.
We need more of you in the world. The medical system is so broken, and a lot of people don't know where to turn. So I hope this reaches a lot of those moms, even in other countries, that then could look for someone rather than going through the regular medical route if they have that option. Some countries, they don't. I mean, you got a medical system, it is what it is, but maybe we'll inspire people just not to go to the visits. You know what I mean?
Yeah, to just look at another option. For sure.
If there's one thing you could tell people, one last thing before we wrap this up, from your heart, what would be something you would say parent to parent? I mean, you have 4 kids, right?
5.
5. Okay. You're not up with me yet, so.
Yet.
My wife would have me trying to catch up, but I think.
Yeah. So what's one or two or some things that you would want to tell parents right now to help their kids have a better childhood?
I think one of the biggest things that breaks my heart is when I have moms and I meet moms in the community that their child is struggling and they've accepted their diagnosis or the problem as a future.
Yeah.
And that just breaks my heart because our body, our nervous system is so amazing. It's meant to heal. And don't give up hope. Don't just give up because you've gone through the system that's literally taken it from you. And keep fighting and looking for options. That's the number one thing. And also just looking for a root cause and how you can create healing. And that's the foundation that most people are trying to find all these different things. And they get so frustrated because, hey, they're going outside in trying to take a medication or often sometimes doing necessary gut healing and other things, but it's not working. It's just hitting a blockade because that nervous system is not in a place it can accept it and deal with it. And that would be my biggest message is don't give up hope. Just like I said, that 26-year-old male who's was never supposed to move past where he's actually seeing healing, and it's possible. And you just got to help create an environment. The nervous system's always meant to heal.
I love that.
I do love that too.
Great advice for any mom. And moms don't give up easily. I say most moms.
No.
And they just keep, I got to find something. I got to find something. Hopefully that will encourage them even more. Thank you so much for sharing your time.
Thank you, Dr. Price. And I'm glad that we were able to talk about prenatal care and, like you said, options. I love that we talked about functional medicine, chiropractic care, with prenatal care. That's important that they don't have to go to the OB. There isn't one size fits all. There are other options out there. So Dr. Harmon, like you said, we're in other countries. So maybe a mom will pause and think, maybe I don't have to do the standard well baby visits or all my OB appointments. I could, go to another doctor or maybe a holistic route.
And if we reach only one mom who saves one kid, that's all worth it.
Yes.
Thanks a lot, Dr. Price.
If
Thank
this
you.
conversation stirs something in you, that's not discomfort. That's recognition. That's your intuition waking back up. Because nothing we talked about today is radical. What's radical is how far we've drifted from supporting mothers, babies, and families at the most foundational level, the nervous system. We don't have a pregnancy crisis because women are failing. We don't have a childhood health crisis because babies are broken. We have a system crisis, one that waits for dysfunction before it listens. And the cost of that delay is paid for by mothers who feel unseen and unheard, by babies whose stress is mislabeled, and by families who are told to manage symptoms instead of asking better questions. This episode isn't about fear. It's about responsibility. It's about understanding that what happens in the womb and early infancy doesn't just pass, it imprints. And once you see that, you can't unsee it. So if you're pregnant, raising little ones, or planning a family, don't outsource your instincts. Ask different questions. Demand care that supports regulation before damage, because the nervous system doesn't need more control. It needs to be supported. Thank you so much for spending time with us today and being willing to listen beyond the surface and choosing to question what you've been told is normal. More next week on Root Cause Holistic Health. Stay grateful, stay grounded.
Thanks for tuning in to Root Cause Holistic Health. We're here to help you uncover what's really going on and empower you to take the next step in your healing journey.
Whether you're a mom, a dad, or just someone ready to stop settling for Band-Aid fixes, we hope today's episode gave you something to think about.
If you found this episode valuable, do us a favor, share it with someone you love, and leave a review so we can reach more families like yours.
Make sure to hit follow so you don't miss next week's episode. We've got more honest conversations, practical tips, and root cause wisdom coming your way.
Until next time, stay grounded, stay curious, and most of all, stay connected to what truly matters.
We'll see you next time on Root Cause Holistic Health.